Hi, my name is Dr. Netta Elbuluk, and I'm a professor of clinical dermatology at the University of Southern California Keck School of Medicine. I'm here at the AAD Innovation Academy, and I just completed a session called Pearls for Skin of Color. I focused on talking specifically about hyperpigmentation and hypo and depigmentation and various pearls related to pigmentary disorders in skin of color. So, a couple quick pearls to share with you from the lecture. I did stress the importance of knowing the diagnosis. So too often what happens, especially with disorders of hyperpigmentation, is that patients are given skin lighteners without actually knowing what the diagnosis is. It is so important to go through that diagnostic workup, which can include using dermoscopy, a Woods lamp, a biopsy, labs if needed, and really find out what condition or conditions they have. That will then guide your treatment. The other thing I talked about is knowing the depth of the pigment that you're dealing with. So particularly with our disorders of hyperpigmentation, you want to know, is this an epidermal, dermal, or mixed process? That's going to affect the treatments that you use. I also talked about procedural treatments. Procedures can be wonderful and very helpful, but you have to use them appropriately and know when to bring them in. There are times when we use them adjuvantly at the same time as our topical or systemic treatments. There are times where they're more of a second or third line therapy, and they help us when we've sort of plateaued or not gotten enough response with our first line therapies. I also talked about the importance of considering patch testing with our patients with ADMH. I always like to stress the pearl of photoprotection for our disorders of hyperpigmentation. And those are just a couple of the fun things that I got to share in today's session.